Good morning. It's still morning, but almost lunchtime. Welcome to the SFHSS Open Enrollment webinar. My name is Jessica Shee. I'm the Communications Director for the San Francisco Health Service System. And today we're here to talk about all of our health plans. So this is a general overview. If you can go to the next slide. Great. So for today's webinar, everybody is going to be on mute, but we do love it when you ask us questions because that's what this webinar is all about. So please look for your menu bar. It's either going to be at the top or the bottom of your screen. There should be a tiny little question mark icon. Hit that icon and you'll be able to open up a live Q&A chat. And that's how you can ask us questions. We will answer as many questions as possible after all the presentations. And if we don't get to your question, or if your question is more complex in nature or personal in nature, we highly recommend you sign up for one of the one-on-one consultations. All of our vendors have offered office hours where you can ask them questions. So without further ado, please play the presentation. Derek, we still have a sound?
Yep, one second, sorry about that.
At the San Francisco Health Service System, who answer your calls when you have a health benefit question. I'm so glad you joined us for the General Health Plan Overview webinar today for all active employees and early retirees, because I care for your health. It's important to be knowledgeable about your benefits so you can choose the right plan for you and your family healthcare needs. If you ever need help to navigate to your health coverage, my team members and I are here to help you.
Hi, I'm Chandra Welsh, the Chief Network Development Officer at Canopy Health. Thank you for giving me the opportunity to talk to you today about our high-quality local network. In January 2021, HealthNet launched Canopy Care HMO, a product that exclusively utilizes the Canopy Health Network to give Bay Area residents like you more choices and greater value for your healthcare. This new health plan features a broad network of doctors and hospitals and is ideal if you live and work in the 9-county region. With Canopy Care HMO, providers have the freedom to help their patients find the right care across the Canopy Health Network. This ensures members are provided with the right care through every stage of life. Community physicians and high-quality medical centers are the foundation of the Canopy Health Network. They're the providers that have been serving our communities, your community, for decades. Today we'll talk about our network and our partners, digital tools, and the member experience and care that Canopy Health provides. We're local. When you utilize the Canopy Health Network, you know that it's owned and operated by local provider organizations in the Bay Area. We're excited to be able to serve you in the entire Bay Area community. Canopy Health is owned by UCSF Health, John Muir Health, Hill Physicians Medical Group, and John Muir Medical Group. These health systems and medical groups came together to provide easy access to high quality, more affordable care with a great member experience. Over time, the Canopy Health Network has grown to service 9 Bay Area counties with over 5,000 healthcare providers and 22 hospitals. The Canopy Health Network also includes a comprehensive ancillary provider network, including urgent care facilities, ambulatory surgery centers, home health care, and durable medical equipment providers. The Canopy Health Network was born and raised in the Bay Area, as were most of our employees. Now let's introduce you to our alliance partners. We have a large Bay Area network of doctors and hospitals. The medical groups in our network include John Muir Physician Network in Contra Costa and Alameda County, Hill Physicians Medical Group located in San Francisco, Contra Costa, and Alameda counties, Meritage Medical Network in Marin and Sonoma counties, the Santa Clara County IPA in Santa Clara County, as well as the Dignity Health Medical Network in Santa Cruz. Listed below are all the hospitals that are located around the Bay Area and are in the Canopy Health Network. These health systems, like John Muir Health, Marin Health, UCSF, and Dignity Health, are recognized for the quality of healthcare services they offer. John Muir Health's Concord and Walnut Creek Medical Centers have again been ranked very highly by U.S. News and World Report in its 2020-2021 list of America's best hospitals. Marin Health is one of America's 100 best hospitals for cardiac care, according to Health Grades, which evaluates nearly 4,500 hospitals nationwide. The Canopy Health Network also includes UCSF Health, which operates one of the top 10 hospitals nationwide. UCSF Health is recognized for its leading work in cancer, diabetes, geriatrics, nephrology, neurology, neurosurgery, ophthalmology, psychiatry, pulmonology, lung surgery, rheumatology, and urology. You have access to the same doctors and facilities our own providers use. You might even someday have an appointment with a doctor who pioneered your treatment. Alliance Referral Program. Eliminate barriers and expedite care. Be in charge of your health care. After you choose a primary care physician or PCP from one of our medical groups, you are not limited to the physicians in that medical group for all your care. Your doctor may refer you to any specialist across the Canopy Health Network, regardless of their medical group. As a member, your selected PCP serves as your healthcare advocate. That's why we ask you to coordinate specialty referrals with your PCP. They have a good sense for the most appropriate referral options based on your health history. They can also help coordinate your care when several specialists are involved. If it's more convenient for you to see a specialist near where you work, you can do that. As a member, you have access to a network of conveniently located doctors, hospitals, and care centers, no matter where you live, work, or play. My Canopy Health mobile app and portal. You lead a busy life, and keeping track of the details, even the important details of your and your family's healthcare, can be daunting. Designed for folks on the go, the My Canopy Health app is a convenient way to connect to your Canopy Health member portal. With your iPhone, Android, or smart device, you've got everything you need to track your health plan details, no matter where or how busy you are. You can use the app or the portal to search for providers and services, schedule an appointment with your primary care physician, PCP, access your virtual ID card, learn more about your health plan, schedule and attend virtual visits, view your test results, health summary, and medication list, manage your prescriptions, learn more about your medications or refill a medication, track your healthcare costs, or find an urgent care facility nearby. Member experience and care. We'd like to talk to you a little bit about why we have a great member experience and seamless care. We offer high quality care across our provider network, friendly customer service managed by team members who understand the Bay Area and understand the provider network, 24/7 virtual visits. At Canopy Health, we work with our alliance partners to provide high quality care and an exceptional member experience. This is reflected in our joint value proposition, which makes us different from everybody else. We provide a choice of providers and provider organizations, each with valuable, distinctive characteristics, so you can find the right fit for your medical needs. We support you by providing easier access to care without unnecessary barriers or hassles. 24/7 Nurse Advice Line. You can access the 24/7 Nurse Advice Line for immediate information about medical concerns. California licensed registered nurses skilled in screening and triage services guide you to the most appropriate level of care, along with health education services. You can also get help with health issues such as how to care for minor injuries and illnesses, how to spot health emergencies, how to take prescriptions, and how to get ready for your doctor visits. After hours and urgent care. You can access emergency and urgent care when you need it without a referral. Find urgent care centers closest to you by searching in the My Canopy Health app or portal. Coordinated care management. With the Canopy Health Network, the medical groups manage care decisions and coordination. This means local providers are responsible for making decisions about your care. You benefit from doctors and care managers who work together to identify your unique healthcare needs and overcome any potential roadblocks to care. Coordinated care is particularly beneficial if you have chronic health conditions like diabetes or heart disease. Health and wellness programs. Access personalized programs designed to help you lose weight, gain energy, and reduce your risk of developing type 2 diabetes and heart disease. Visit healthnet.com/SFHSS for more information. Chiropractic care and acupuncture services. HealthNet, through American Specialty Health, provides chiropractic and acupuncture services to Canopy Care HMO members. Prescription drugs. You can use many independent pharmacies and chains to fill your prescriptions at convenient locations where you most likely already shop. HealthNet offers mail order and specialty prescription drug programs delivered to your home or workplace at no cost to you. Contact Canopy Care HMO Customer Service Center for information on how to obtain your self-injectable medications, excluding insulin. If you'd like to learn more about the Canopy Care HMO, please visit healthnet.com/SFHSS. Thank you.
Hello, my name is Adam Gunther, and I am a Senior Account Service Representative here at Blue Shield of California. In this presentation, I will go over, at a high level, the plans and discount programs available to SFHSS members for 2022. Blue Shield of California, your coverage, your care, your future. Blue Shield offers comprehensive plans and access to some of the largest doctor networks in the state. We also offer customized care programs, discounted wellness products and services, along with digital tools for preventive care, treatment cost estimating, medical advice, service referrals, and ID theft protection. Blue Shield is mission-driven with offerings to ensure affordable care for all. Now let's take a glance at your plan options. SFHSS members have 3 plan options available to them: Access Plus, Trio, and the new Blue Shield of California PPO Accolade plan. The Access Plus and Trio plan benefits remain the same from 2021 to 2022. The Access Plus and Trio plans are both HMO plans which require you to choose a personal care physician, or PCP, who will be associated with the medical group. Your care is handled within your chosen PCP's medical group, and you must stay within that medical group for all your care. Both the Access Plus and Trio plans are copay driven with no deductibles. The medical plan benefits for Access Plus and Trio are the same. PCP visits are $25, specialist visits are $30, with outpatient surgery in a hospital at $100 per surgery, and inpatient hospitalizations are $200 per admission. The main difference between the Access Plus and Trio plan is the Trio plan has a narrower network. In essence, all the doctors and hospitals in the Trio plan are in the Access Plus plan, but not all the doctors and hospitals in the Access Plus plan are in the Trio plan. Next, let's go over some similarities and differences between the Access Plus and Trio HMO plans. The Trio plan has a lower monthly premium compared to the Access Plus plan. The Trio plan also has a narrower network of doctors and hospitals compared to the Access Plus plan. However, both plans allow the member the option of self-referring to a specialist within the same medical group. Both plans offer urgent and emergent care when traveling in or out of the United States. Both plans offer Teladoc virtual care doctor consultations and mental health professionals at a $0 copay, and both plans offer the Blue Shield of California Wellvolution program. Only the Trio plan offers the following: an enhanced customer service experience via Shield Concierge, LifeSpring, a meal delivery service, and Call the Car, a non-emergency transportation service, are available for qualified members while recovering from serious illness. Eligibility for these 2 programs is determined by a Blue Shield case manager. Access to healthier foods at a reduced price through Healthy Savings, and My Strength, which is a flexible and comprehensive digital program with proven tools and dedicated support for stress, depression, sleep, and more. New to SFHSS members effective January 1st, 2022 is the Blue Shield of California PPO Accolade plan. Accolade is a confidential service that helps members navigate their benefits easier and with less stress. With Accolade, you and your family will connect with a health assistant for member services. You can message or call an Accolade Health Assistant for help with health and benefit questions, big or small. Your health assistant takes time to get to know you and understand your needs while partnering with a team of doctors, nurses, and benefit specialists to support you in making the best healthcare decisions possible. This plan is a PPO plan, which is co-insurance driven and does have a deductible that must be met before Blue Shield pays anything. PCP and specialist visits are 15% in-network and 50% out-of-network. Outpatient surgery in a hospital as well as inpatient hospitalizations are 15% in-network and 50% out-of-network. In this PPO plan, you have the flexibility to see any doctor or go to any facility you like, whether they are in or out of the Blue Shield network. However, out-of-network benefits do have a higher coinsurance. For additional information on doctors or facilities which are in the Blue Shield of California network, please go to www.blueshieldca.com and access our Find a Doctor tool. Let's talk about some additional support and programs offered to members who enroll in the Blue Shield of California PPO Accolade plan. Accolade's frontline care team of health assistants are dedicated to SFHSS members for personalized support with intelligent technology and a team of expert clinicians. SFHSS members can access this team of expert clinicians via the phone, mobile app, or member portal. SFHSS members have access to a health assistant or a nurse if needed, who can assist them with member or provider support questions, care management programs, referrals, and any benefit questions or guidance they may need. Also available to Blue Shield of California PPO Accolade members is Ginger. Ginger is a fully integrated virtual care app which offers behavioral health coaches available 24 hours a day, 7 days a week, on demand, within 1 minute, and with psychiatrists and therapists who can be accessed within 12 hours, all from your smartphone. Another program available to Blue Shield of California PPO Accolade members is Hinge Health. Hinge Health is a proven end-to-end digital musculoskeletal solution. It offers SFHSS members proven outcomes for digital care for chronic back and joint pain through exercise therapy, behavioral health, and education. Hinge Health can assist with preventive, acute conditions, chronic conditions, and surgery, all by offering anytime one-on-one virtual physical therapy, exercise videos, education, behavioral changes, pre and post rehab, and continuity of care. Now let's talk about wellness. How can you jumpstart your well-being? Wellvolution is a program offered to all Blue Shield of California SFHSS members. Wellvolution offers online and in-person clinical programs to help you lose weight and improve your health. There are programs for weight loss, which will assist in lowering your risk for diabetes, high cholesterol, high blood pressure, and obesity, along with assisting you to live healthy by managing stress, planning meals, and sleeping better. Wellvolution offers way too many programs to list, so for more information on Wellvolution program, please visit www.blueshieldca.com/Wellvolution to view the available programs and create an account. SFHSS members also have access to preventive care for annual screenings at no charge. This includes routine physical exams, ear and eye exams for children up to 18 years of age, and immunization and screenings according to an age schedule. To find out more information and answer any preventive care questions you might have, please visit www.blueshieldca.com/preventive. Blue Shield also has ongoing editorial articles focused on wellness and prevention available through Blue Shield's bi-weekly monthly Blue Living newsletter, which can be found on the Get More Hub, which is located at www.blueshieldca.com/getmore. An additional discount program offered to Blue Shield of California SFHSS members is the Blue Shield Fitness Your Way program powered by Tivity Health. With our Fitness Your Way program, SFHSS members 18 years of age or older can get healthy and feel good on your own terms. You pay a one-time initiation fee of $25 and then a monthly fee of $25 per person for access to over 10,000 plus gyms with 800 located here in California. You can work out anytime, anywhere, and track your goals and progress online. For more information on this program, please visit www.fitnessyourway.tivityhealth.com/BSC or call 833-283-8387. SFHSS offers both chiropractic and acupuncture benefits with all of their Blue Shield of California plans. However, if you happen to meet the maximum on your plan, Blue Shield offers an alternative care discount program. You can save up to 25% on acupuncture, chiropractor, and therapeutic massages. For more information on the alternative care discount program, please visit www.blueshieldca.com/wellness discounts or call the Alternative Care Discounts Program at 888-999-9452. Here at Blue Shield of California, we want you to know that life is limitless and to never stop. Thank you for your time. Feel free to visit www.blueshieldca.com/SFHSS for more information on the offered SFHSS benefit plans and discount benefit programs with Blue Shield of California.
Hello and welcome. To find your healthy place, you and your family need high quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan, which makes your life easier. Today, I'll be highlighting your plan benefits, our integrated quality care, digital care options, and membership perks. This information will help you select with confidence the right health plan for you and your family. Now, are you ready to get started? Great, let's begin. We can help you get to your healthy place, no matter where it is. We combine care and coverage, which makes us different than your other healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you through our electronic health record. They can see your health histories, such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an x-ray, or even pick up your prescriptions all without leaving the building. Care feels easier and faster and is centered around you. Having a doctor you connect with is essential to getting excellent care. Your personal doctor is the biggest advocate for your health and will help coordinate the care you need to get healthy and stay healthy. Members can choose or change doctors at any time for any reason by browsing our online profiles at kp.org/search doctors. You have the freedom to choose a physician that best meets your needs. You can search doctors accepting new patients by gender, location, languages spoken, and even view their photos, education, and credentials. Next, let's review how we're leveraging technology to provide convenient ways to get care. When you need care, you can have an appointment in person with your physician, over the phone, or video. You can get advice 24/7 over the phone, online through an e-visit, or email your doctor's office with a non-urgent question and get a response within 2 business days. You can also manage your care at your fingertips anytime and anywhere. Schedule or cancel routine appointments online, refill most prescriptions, check most lab results, and even pay your bill. Next, let's look at the many care options while away from home. Since keeping you safe and healthy is our first priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at Minute Clinics or Concentra urgent care centers when you're traveling outside of a Kaiser Permanente area. If you seek urgent care at a Minute Clinic or Concentra urgent care center in a state where there's a Kaiser Permanente facility, but you're outside of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, contact the Away From Home travel line, available 24 hours a day, 7 days a week, and visit kp.org/travel. Now let's review some of the membership perks to help you feel your best. Good health goes beyond the doctor's office. Here are some of the wellness resources available at little or no cost to help you thrive. Members can take advantage of our health education classes. wellness coaching by phone, and online wellness tools to improve their health and save money. In addition, you can stay physically and mentally fit with these wellness offerings. ClassPass, which provides on-demand video workouts and live stream fitness classes, including Pilates, dance, and boxing. And self-care apps such as Calm to practice mindfulness with guided meditations, relaxing music, and sleep stories. Lastly, get special rates on a variety of services and gym memberships through our Choose Healthy program. These include specialty care services such as acupuncture, chiropractic care, and massage therapy. Now let's look at a high-level overview of your traditional HMO plan with the City and County of San Francisco. This plan offers comprehensive coverage at a copay or coinsurance. There's no annual deductible, and the out-of-pocket maximum is $1,500 for an individual or $3,000 for a family. This is the most you'll pay out of pocket for most covered services during the accumulation period. Preventive care is covered at 100%. Office visits are $20 copay per visit. You can save money with phone and video visits with your doctor, which is offered at no cost. Hospitalization is $100 copay per admission. Emergency care is $100 copay per visit. Lastly, prescribed medications up to a 30-day supply is a $5 copay for generic, a $15 copay for brand name, and a 20% coinsurance not to exceed $100 for specialty. If you take any routine medications, speak with your doctor about our mail order service to receive up to a 100-day supply for only twice the copay. Next, let's look at the additional benefits offered through this plan. Your plan also covers fertility services at a 50% coinsurance. Assisted reproductive technology such as IVF is covered up to 2 treatment cycles per lifetime. Kaiser Permanente provides care to all members regardless of their relationship and gender status. You can get started by speaking with your doctor about what treatment option is best for you. Acupuncture and chiropractic care are also covered through the American Specialty Health Network. No referral is needed. You're eligible for 30 combined visits per year at a $15 copay per visit. To find a participating provider, use the link or phone number displayed on this slide. Now let's highlight the new member onboarding. As soon as you join, we want to make your care experience easier. We provide personalized onboarding with a welcome call and a member guide so it is easy to get started. You can also visit kp.org/new member to get registered, choose your new doctor, transition your care and prescriptions seamlessly, and schedule your first appointment. If you still have questions, we are here to support you. Choosing a health plan is a big decision, but you don't have to make it alone. We're here to answer any of your questions so you can make an informed decision. If you have questions about the essentials or the extra features, call the number listed on the screen. For additional information and plan documents, please visit the microsite listed on this slide, where you'll find content tailored specially for City and County of San Francisco employees and early retirees. Thank you for your time and attention. Today, we reviewed the benefit of choosing Kaiser Permanente, the resources to help manage your plan, and membership perks available at little or no cost. Now you have the information you need to select with confidence Kaiser Permanente as your health plan. We look forward to providing quality, integrated care for you and your family very soon. May you live well, be well, and thrive.
I would like to thank everyone for taking the time to learn more about your benefits offered by United Healthcare and your employer. The plan we're going to be considering today is a United Healthcare Companion Plan PPO. This plan is for dependents with a family member enrolled in the UHC Medicare plan. An overview of the plan will be provided on the following slides. With the United Healthcare Plan, you get our national network and out-of-network coverage. You can receive care and services from anyone in or out of our network. Providers in our network have agreed to provide services at a contracted rate. Out-of-network providers have no such obligation, which means that services with an out-of-network provider will cost you more. Consider choosing a PCP who can be your partner in managing your care. Preventative care is covered at 100% in our network. When it comes to paying for in-network care, here are some examples of basic costs. The deductible is $250 per person and up to $750 for a family. After you reach your deductible, your coinsurance for a PCP or specialist visit is 15%. And the individual out-of-pocket maximum or limit is $3,750, and the family out-of-pocket limit is $7,500. This policy contains exclusions and limitations. For coverage details, please see your official health plan documents. Use one of these three ways to find a provider or determine if the provider you're currently using is in our network. Look for the search for a provider button on the www.yuhc.com/SFHSS. Call the number on your plan health ID card. Search using the United Healthcare mobile app. Upon enrolling, activate your myuhc.com account to help you manage your benefits and healthcare. Doing so will allow you to do the following: find network providers and provider locations, check account balances, manage your claims, track expenses, and pay your medical bills, estimate costs for care, learn about covered preventative services, find and compare medications, refill, renew, and transfer home delivery prescriptions. Now let's take a look at your pharmacy coverage. OptumRx is your United Healthcare Plan's pharmacy care services manager. OptumRx is committed to helping provide you with safer, easier, and lower cost ways to get medication you need. United Healthcare Prescription Drug List, or PDL, is a list of commonly prescribed medications covered by the plan. The PDL is organized by cost level, known as tiers. Choosing medications in the lower tiers may save you money. The United Healthcare Companion Plan prescription coverage is as follows: $10 for Tier 1 medication, $25 for a Tier 2 medication, $50 for a Tier 3 medication. Use network pharmacies and you'll generally pay less out of pocket. Our network includes thousands of pharmacies across the country. Before you go to pick up your prescription, check the medication costs online at myuhc.com. When you arrive at the pharmacy, present your health plan ID card. The pharmacy will verify your eligibility and advise you of any out-of-pocket costs you owe at the point of sale. With myuhc.com and the United Healthcare app, you can enroll in home delivery, find network pharmacies, refill your prescriptions, and set up helpful reminders, estimate and compare medication costs, and search your plan's prescription drug list. Note, the United Healthcare app can also help determine how a medication is covered and whether or not there are other options to help you save money. Now, let's talk about some additional benefits included in these plans. You can count on us to help make your health experience easier. We'll give you support designed to help you save time and money and find care when you need it. Help is a call, email, or web chat away. Contact us for help with a personal touch. As a member, you can reach us by phone or by logging onto myuhc.com and clicking on the call or chat button. We're available Monday through Friday during business hours. Rally is a digital experience on myuhc.com that's designed to help you make healthy changes to your daily routine. Set SMART goals and track your progress. Get personalized recommendations to help you move more, eat better, and improve your health, and have fun doing it. Earn credits for taking healthy actions, connect with a community of people, and get the support you need to stay motivated. Whether you want to lose a lot of weight or just a few extra pounds, Real Appeal is designed to help with simple steps and support along the way for lasting weight loss. This program will include a personalized transformation coach who will guide you and customize steps to fit your needs, personal preferences, medical history, and goals. 24/7 online and mobile app to help you stay on track and reach your goals. A success kit featuring a personal blender, digital food scale, and more. Get access to care online at any time. When you need care anytime, day or night, virtual visits can be a convenient option. From treating flu and fevers to caring for migraines and allergies, you can talk to a doctor by video or phone 24/7. Please note there is a cost for virtual visits. Please see your health plan documents for coverage details. To learn more, visit us online or give us a call and we'll walk you through everything. Thank you for attending the presentation.
Hello, my name is Carrie Bashirs, and I'm the Wellbeing Manager with the San Francisco Health Service System. I'm going to spend a few minutes highlighting some of the well-being resources available to you as an active employee. We offer a number of different free support programs. The Diabetes Prevention Program, we have a Healthy Habits Program that focuses on healthy weight, managing your weight, sleep, exercise, among a few of them. We also offer group support programs such as resiliency groups, healing circles, lifestyle coaching, and flu clinics. We are upon flu season, so please schedule your flu clinic today for an on-site at your work location. EAP. EAP is our free 24/7 confidential telecounseling service. You can access them at any time at 1-800-795-2351. During business hours, Monday through Friday, you will be connected with one of our internal EAP counselors. Outside of business hours, you will connect with a professional who will then schedule you an appointment with a counselor. Some additional services that are available through our EAP service are mediation and conflict resolution. I mentioned earlier some of our resiliency groups. They do individual consultations, leadership consultations, training workshops, and critical incidents response. So if you're looking for any of these services, please call EAP. Some additional items that are available to you are Credible Mind, which is a resource hub with over thousands of different resources related to mental health and well-being. You'll be able to find podcasts, articles, apps that you might be of interest that you can go to and learn more information. We offer trainings, there's webinar classes, we have gym discounts, and of course we also offer information related to pregnancy and lactating mothers. For more information, you can contact us at 628-652-4650.
Great. Thank you to all of our presenters. And now this is our live Q&A session, which is my favorite part. And I already see we have some wonderful questions in the chat. And while we're at it, Derek, if you don't mind, could we share the raffle link so that those who just wanted to see the presentation can enter the raffle drawing? And I'm going to go down the list of all of the questions that we got. So can you please give us the links of previous recorded webinars for open enrollment? Absolutely. If you go to our website, sfhss.org/OE 2022, and if you just scroll down a little bit, you'll find a little calendar icon. Hit that calendar, and all of the previous webinars that have already taken place will have the recordings in that calendar. Next question, can you reiterate the basic differences between Blue Shield Trio HMO and Access Plus HMO? Is it basically access to Sutter Health in Access Plus? So Tiffany, thank you for answering that question in the chat. Can you also share the question out loud for all of our members?
Sure. So basically the Trio HMO is a subset of our Access Plus HMO network. And in the Trio plan does have access to our Sutter facilities in San Francisco, but not the physicians that have are moved to a different medical group than Brown and Toland. So the outside of San Francisco, the Sutter facilities and providers are not a part of the Trio network, but are part of Access Plus. So that is one of the differences. There's also some that we reiterated in the presentation in terms of kind of bells and whistles that we add to our Trio plan. And plus part of the accountable care organization partnerships that we have on the Trio side, where we work really hard on quality metrics, et cetera, with our partners. So there's a lot to Trio I didn't add in there, but if you're just talking about the network, Sutter Health is a little bit of the difference between the two.
Thank you, Tiffany. And the next question is again about webinars. And yes, you can access all of our webinars on our calendar on our OE webpage. And why is Kaiser not listed? Kaiser is definitely a choice for all of our members, whether you're an active employee or retiree. So, and Denise, I saw that you answered that question already. Perhaps it was at a certain presentation. So thank you for doing that. Next question, that's a significant difference under Blue Shield, even Access Plus. You are limited to only providers within your PCP's IPA. Okay, Tiffany, did you want to discuss the PCP's IPA for Blue Shield?
Sure, I can discuss that. I think this was part of the Canopy presentation. And it was actually, I do think that Chandra did answer that appropriately. And you are, the person is correct that we are limited to if you choose a primary care physician within, like, say, Hills Physicians, then you are seeing specialists within Hill Physicians, which it sounds like Canopy Care might be different.
Yes, Chandra, if you don't mind, could you share this answer for everybody's benefits to explain the difference in Canopy Care's network?
Absolutely. So the unique feature of Canopy Care is that we have the Alliance Referral Program. So normally in an HMO, you are limited to just the physician group where your PCP is. But the unique feature is that in Canopy Care, if you have a primary care physician in one group, say Hill Physicians, but your doctor and you want to be referred to a specialist, say within John Muir, we have that ability. So they would be able to refer you over to a specialist in one of the other groups within Canopy. And it's a great feature in the network that allows you to see providers across the entire network instead of being limited to just one IPA or medical group. Thanks for the question.
Great. And the next question, I believe, is for Tammy Madsen. Is the Canopy Care Mental Health Network limited to Magellan like Blue Shield, or what other additional limitations are imposed on mental health care under Canopy?
Yeah, great question. HealthNet, we use MHN, which is Managed Health Network. We do not use Magellan. I would suggest that they contact our MHN network, and they can advise them which doctors are available through our MHN program.
Great, thank you. And the next question from Michael. Yes, I hope you were able to stay for the Kaiser Health Plan presentation. And Michael, again, I'm trying to decide between Kaiser and other health plans that are offered in San Francisco. That's wonderful. Let me see if, and thank you. I want to thank all of our presenters for answering Michael's questions to help him with his decision and to learn more. And Michael, if you have more questions, please throw them into the Q&A chat. So can each plan review their limitations and exclusions on fertility preservation benefits? That That is a great question. And Holly, thank you for sharing. We actually had a Starting a Family webinar, which is already recorded and the video is on our website. But for this Q&A, if we can have all of our plans just explain how the infertility benefits work, that would be great. Can we start with, is it Tammy with HealthNet and Canopy Care?
Yes. So for our infertility benefit, it's covered at 50%. We have 6 procedures per lifetime for artificial insemination. We also cover ZIFT and GIFT. There's 2 procedures per lifetime, and it's excluded from our out-of-pocket maximum. So I hope that answers your question.
Great, thank you. And Tiffany, can you explain that benefit for Blue Shield?
Sure. Our benefit is similar on the HMO plans, the Trio and the Access Plus, that it's covered at 50%. We do cover several assisted reproductive technology procedures, 6 procedures per lifetime for artificial insemination, 3 procedures for stimulated artificial insemination, GIFT and ZIFT or IVF at 2 procedures per lifetime. We have, and then kind of several others, ICSI, assisted embryo hatching, elective single embryo transfer, including preparation of embryo for transfer, pre-implantation, genetic screening for embryo biopsy, cryopreservation of embryos. The last 4 that I mentioned, there's no benefit maximum. And then the cryopreservation of embryos, oocytes, ovarian tissue, and sperm is 1 egg retrieval on 1 year of storage in a lifetime. Those are the benefits on the HMO plan. The PPO plan has similar benefits, and it's all listed. I did give the links on the site to get a little bit more information on that.
Great, thank you. And new this year was the pharmacy drugs to support infertility. Are those now covered?
Yes, they were covered, but they were covered under the medical group. Now they're being covered under Blue Shield on the HMO side. So that's kind of the difference there. There was some confusion between kind of medical group versus Blue Shield, and those are now getting paid basically under both if necessary, depending on how the member is accessing that.
Right.
Those are prescription benefits.
Thank you for that. And for Tammy, for HealthNet, I believe that the benefits are pretty much matched for all of our plans. Is that correct? So the pharmacy drugs that would be necessary for these procedures would also be covered. Is that correct?
Yes. But I would recommend if the member has some, detailed questions, we offer office hours so that members can ask their personal questions and get an answer from an associate directly.
Thank you. That is a great point. And Paulo, can you explain the benefit for Kaiser? I know they're all very similar.
Yes, thank you. So we do cover the diagnosis and treatment of infertility, artificial insemination, and as well as assisted reproductive technology. That's just a long term for IVF treatment, ZIFT and GIFT. We cover 2 cycles per lifetime at 50% coinsurance. As far as fertility preservation goes, it includes retrieval of egg and sperm, as well as 1 year of storage for any medical condition where it would be necessary to go this route. And it's also excluded from the out-of-pocket maximum. So just keep that in mind, but it is covered at 50% coinsurance. All the office visits, the drugs, the procedures, it's all at 50%.
Sorry about that. And for UHC, thank you, Hector, for really spelling out that these benefits are available to dependents of employees enrolled in UHC Medicare.
Yeah, so the the enrollee would have to be a dependent of somebody who's already enrolled on the United Healthcare Medicare plan. I did drop the basic coverage into the common field, and it's like the other ones. Infertility coverage is limited. So I do recommend scheduling an office hour and one-on-one to ask any specific questions regarding infertility.
Thank you, Hector. And for the next question, I have Blue Shield Access Plus, it's great, but my PCP is under Brown and Tolan. I was told that there is no more Brown and Tolan. What would happen to my PCP? Do I need to select another PCP under Blue Shield? Tiffany, I saw that you answered this in the chat. Thank you so much. Can you explain this to all of our members?
Sure. I'm not really sure where the Brown and Tolan disconnect is. You know, sometimes there's just misinformation. Sometimes you mishear something, but Brown and Tolan is not going away anytime soon. And they are a part of all of the Blue Shield networks. So the Trio, Access Plus, and they're part of their providers are also in our, most of the providers are in our PPO network. So it may be that either your PCP switched to a different medical group, which can sometimes happen, or your PCP has left that medical group, which can also happen. So I would definitely recommend actually calling the number on your ID card and talking to one of our customer service reps, and they can walk you through what scenario might be happening with your primary care physician if your primary care physician is no longer in the Brown and Tolan network, and whether or not if they've switched to a different medical group, then you should just be able to switch to a different medical group with them if you would like to do that, or you can switch to a new PCP within Brown and Tolan if you would like to stay in Brown and Tolan, or some of the options that may be available depending on what's going on with that scenario.
Great, thank you for clarifying that, Tiffany. And since Kaiser is not part of the network, should I change over from Kaiser to another PPO plan once retirement is coming close? And I see that Denise already answered that question. And we actually do offer Kaiser for retirees. We have the Kaiser Medicare plan for retirees. It's just available in different regions, so it really depends on where you live after you retire. And we only have two plans right now, so it's either the Kaiser HMO or the United Healthcare PPO Medicare Advantage plan. And we actually have another Medicare webinar coming up soon. I'm not sure, Holly, if you could look up that date and supply that link, that would be great. And I had a major sticker shock at the switch to Accolade as the PPO plan. It's over 2 times as much as City Plan per paycheck. This is prohibitive to most employees. I'm wondering what factors motivated this decision. So I'm not Tiffany, can you explain the benefits of Accolade for the new PPO plan? And I can look up, I don't believe it's actually that much more, but I do believe your rates are dependent on what your group and your union has negotiated. So we would need a little more information to understand what the price or cost difference was in the plans. But Tiffany, if you can explain the Accolade difference, that would be great.
Sure. What we're trying to accomplish with the switch from, with the Blue Shield and Accolade is a higher touch customer care and care management model. So with Accolade, you get an actual dedicated, kind of representative that will be your person to talk to with any questions that you call on when you call with Accolade. And they may also end up reaching back out to you and talking with you about any of the benefit questions that you'd had or any services that you have upcoming. So it's more of a high touch. But like you said, Jessica, I'm not aware. I didn't think that I knew the benefits were not changing, moving from United Healthcare to Blue Shield. And I was not aware that the cost was changing too much either. So that I can't really speak to in terms of that either.
Thank you, Tiffany. And the next question is for Blue Shield Access Plus, does the physician have to be where you live? I had moved to the east, but my primary is in the peninsula. I currently have United Healthcare, which is now becoming Accolade. And Tiffany, I saw you answer that question. Could you share Could you share it for all of
Sure.
ours?
For our HMO plans, Trio and Access Plus, you do have to live or work within 15 miles of the medical group. That is a state mandate that we have, not something that we can really get past. So we do with the PPO plan. You may want to stay on the PPO plan to be able to access those providers. And that PPO plan is now with Blue Shield. And more than likely, if they were part of the United Plan, a network of doctors, they're part of our network of PPO doctors as well. You can definitely check that on our website if need be. But in general, we had very little disruption in terms of the providers, especially in the Bay Area. But if you are further than 15 miles from that doctor on the peninsula now, you may want to continue on to the PPO plan.
Great, thank you. And the next question is from Diane. I'll be moving out of California to Virginia, not eligible for Medicare. Not sure what health plan to choose. Also, when is the next open enrollment? So for the last part of your question, the next open enrollment would be next October in 2022. And we're not sure when you're retiring, but Tiffany had already shared in the chat that the Blue Shield PPO plan would be available to you if you're an early retiree. And so you can certainly choose that. The one thing I'm not 100% sure, Paulo, could you help me, is Kaiser an option for early retirees in Virginia?
I would have to defer that question to Debbie. Debbie, are you still on the call?
Yes, I am. And the question is, or the answer is no. We don't have a contract in that area.
Okay, so then the only health plan available for an early retiree in Virginia would be our PPO plan. And
one thing to note, Jessica, is possibly if you're moving like mid-year, they could have a kind of like a change of address or change of right status. So is that something that's not like something that's Blue Shield, but that's more kind of SFHSS in terms of she could maybe select and the HMO plan that's local that costs less, and then at retirement, is that available in terms of a change of address and a change of status to be able to move to a different plan?
Yeah, so retiring and moving would be considered a life event, so you can change your benefit when that happens. And Sonalion, just to fact check me, just in case I'm incorrect there.
Hi, Jessica. This is Holly, one of the moderators. Sonali is not on the call right now, so we may need to refer to office hours or member services. And then I just wanted to give a heads up that we have just about 3 minutes left, and I'll be sharing that member services contact information for anyone on the call.
Oh, that's great. Thank you for the reminder. Can we go to the slide for office hours too? So if you go to our open enrollment webpage, you can actually choose to get a one-on-one appointment with any of our health plan providers. They're all offering it, and they would be more than happy to discuss your particular needs. And then on top of that, if this is an account-related question with SFHSS, you're also welcome to call SFHSS member services. They're always happy to help as well. So I'm in the 2 minutes that we have left, I am going to ask all of our moderators to put that raffle drawing link in the chat once again. And I'm just going to see if we can answer at least 2 more questions. So I just noticed that for retirees without Medicare does not price, sorry, the brochure is for 15 to 20 years of service and 20 years plus of service. Does this mean the city will cover all premiums without Medicare, like those for 55-year-olds with no Medicare? So it really depends. I highly recommend that if you're considering retiring, you schedule a retiree consultation, because certain propositions will impact depending on your hire date. And you'll also have to go to your retirement center first to determine how many years of credited service that you have with the city before you go to SFHSS, so that we can help you calculate your benefits. And what is the coverage like under these plans if traveling or attending conferences outside of the US or overseas? I'm assuming there is no travel rider and coverage is 0, i.e. 100% out of pocket. So, okay, and I see, thank you so much to the health plans for answering this in advance. Tammy, could you just quickly share what happens when we have a member traveling out of the US?
Sure.
And services?
Absolutely. Coverage for those that are traveling outside the US or in the US, but outside your service area, you're covered for emergency or urgently needed services. Your urgent care copay is $25 and $100 for the emergency room. And in the event in the emergency room you are admitted, that $100 copay is waived, but then your hospitalization copay kicks in.
And Paulo for Kaiser?
Yes, we provide coverage for emergency and urgent care anywhere in the world as well. If you're traveling abroad, you will have to pay out of pocket the full charges for the services you receive and then file a claim to get reimbursed. You'll need to submit proof of payment, doctor's notes, and itinerary to get reimbursed, but you'll still be responsible for the same cost share described in your plan as if you were getting care at Kaiser Permanente, which is $100 for emergency care and $20 for urgent care. If you're ever unsure whether you need one versus the other, you can always call our 24/7 advice nurse line to help determine the appropriate level of care that you need and get some medical guidance.
Great, thank you. And Tiffany, it's pretty much the same for Blue Shield. I don't know if there's any more you want to add.
It is, we're good. That is pretty much the same. Thank you.
Okay, great. And I know we're already at time, so this will just be our last question for Kaiser. Do we need doctor's referral to get acupuncture or chiropractic care, or can we just get them on our own? Paulo?
Yeah, so you don't need a referral to see a chiropractor or acupuncturist. They are contracted through American Specialty Health. So I provided the link in the chat for you to find a participating provider in your area, but essentially you'll just contact the provider directly, let them know you're a Kaiser member, and then pay your copay at the time of your visit. And that's pretty much it.
Great, thank you so much, Paulo. And we are at time. I do see that we still have several questions that are unanswered, so please schedule time for one of the office hours or to call member services with your questions. And I want to thank everyone for participating and joining us today. We hope that you learned something new that will help you make your decisions for this open enrollment. Thank you so much and have a great afternoon and lunch.
Thank you.
Thank you.